So good morning everyone. Good morning to all the judges here on the dais and good morning to all the participants. Thank you. So I'm Dr. Bhavik Panchal and I'll be presenting an analysis of the penetrating ocular injuries with intraocular foreign bodies to understand the variation in the clinical manifestations and the outcomes. There's no financial interest in this presentation. Just a brief background. Eye injuries with retained intraocular foreign bodies basically remains one of the most important causes for vision impairment across all the ages. Okay. And incidence of intraocular foreign body related injury accounted from 6% to even as up to 45% amongst patients with open globe injuries. So the purpose of our study was to study the various patterns and outcomes of penetrating ocular injuries with intraocular foreign bodies alone, and a study aims to explore the distribution of final vision compared to the ocular trauma score. It was a retrospective study and the study duration period was from January 2017 to December 2022. This included all patients who had an intraocular foreign body present. Coming to the statistical analysis, a categorical data was described by percentages, whereas the continuous data by mean, median, and wherever it was appropriate. The Snellen's visual acuity was converted to logMAR, right, where certain values like 2.3 for hand movements, 2.7 for light perception, and 3 was for no light perception. Eventually, a multivariate logistic regression analysis was performed to explore factors which are associated with poor vision outcome, that is and vision that is less than 2400. Don't worry, I'll finish before 6 minutes. So the statistical analysis is poor vision outcome was determined as vision worse than 2400 as I explained. Based on their size, the entry wounds are divided into two categories, which is less than 3 millimeters and 3 millimeters and larger than 3 millimeters. So we used the Starter software for this statistical analysis, and p-value of less than 0.05 was considered to be statistically significant. Coming to our results, 116 patients with open globe injuries with an intraocular foreign body were analyzed. The mean age of these patients was 33.8, whereas the range was from 6 to 75 years of age. And the mean standard deviation was, for the follow-up, mean was 12.1 months. So we had an average of 1 year follow-up for these patients. Males were predominant. If you see, as much as 94% of the population was males, and a similar distribution between the age groups was noted. So if we look at the percentage of patients with intraocular foreign body, majority of the patients were in the age group 31 to 60, that is around 50% of the patients. And as I mentioned, only 94% of the patients were males. So out of which majority of them were in the age group 31 to 60. For the pediatric age group, around 14 patients fell in the pediatric age group, and the elderly age group only 5. So it was a working class population which presented to us with an open globe injury. If you look at the activities which involved with intraocular foreign bodies post open globe injury, the most common was hammering, that is a hammering and chiseling type of injury, around 33%, followed by work at construction, carpentry or repairing. And the next percentage was of bystander injury and playing. So again, if we categorize them, the proportion of patients with intraocular foreign body by age group and related activities, playing was injury while playing was the most common form in the pediatric age group, whereas hammering, it was the age group 31 to 60, same construction, carpentry, repairing, that is injuries at workplace. So this explains that the safety, if we provide safety glasses, this all can be prevented. Right. So majority of the patients presented to us in the later half of the week. So we had more patients in Thursday, Friday, Saturday compared to the first half of the week. Most common occupation was that of a coolie or a manual laborer, followed by student. Median interval between injury and presentation was 2 days. And the most common intraocular foreign body was metallic foreign body, with size of 3 to 6 mm was the most common size of foreign body noted. Corneal injury was the most common with foreign body in the anterior segment. Again, 63% was metallic foreign body. Only 5%, 6 cases had wood as a foreign body. The mean OTS score was 56.3 prior to injury. Between both the eyes, there was no difference between both the eyes. Mean interval between presentation and the surgery was 4.5 days. So the patient presented within 2 days of injury, and between surgery and the presentation and surgery, it was around 4.5 days time. Mean presenting visual acuity was 2.69, and there was an improvement in the visual acuity of 1.3. just to understand the complications and microbiological profile, 13 patients developed endophthalmitis or panophthalmitis, out of which 10 went into phthisis bulbi, 4 were eviscerated, and 1 developed sympathetic ophthalmia. If you look at the microbiological profile, 11 patients had infection due to gram-positive bacilli, and 4 had fungus, and 6 had gram-negative bacilli. Again, a busy table just to explain from the multivariate analysis. Presenting visual acuity and endophthalmitis are the 2 most important factors which led to poor visual acuity less than 2400. So, majority of individuals were young males compared to the literature which showed older age group. Incidence of eye injuries, especially those with foreign body, can be reduced by following the safety recommendations I explained. Education regarding a safe distance from areas with potentially hazardous activities should be emphasized. Okay, and safety pitfalls should be reviewed to enhance the effectiveness of eye injuries. Significant predictors implicated are initial visual acuity at presentation, wound size, retinal detachment, endophthalmitis. One limitation is the retrospective nature of this study, and long-term ocular complication could not be estimated as the patient were referred back to the primary physicians. Last slide on conclusion. This study reported a predominance of working males and hammering activities as a major relevance of IOFB injury. Overall, for visual estimation, the highly predictive value of OTS were indicated in IOFB-related open globe injuries with a much higher score corresponding to a poor visual outcome. Thank you so much.
Sir, what was the end result of sympathetic ophthalmitis case, sir?
Sorry?
What was the end result of the sympathetic ophthalmitis person?
So, in that particular case, the eye which had injury was already into phthisis. The other eye developed sympathetic ophthalmia, and it was a good outcome if we pick it up early because patient was under follow-up.
What could be the reason for presenting in the latter half of the week, sir? Second half of the week? Okay.
It's possible. No, this is just an analysis. We even did analysis about time of presentation, whether they came in the before noon or afternoon. They could not present it here. Even the day, even the month as well. So we found majority of the injuries in the between April to June, rather compared to the winter season. I don't know relevance of it. Maybe you have to look further in, but it's a good question.
It was a nice presentation, Panchal.
Thank you so much, sir.
Did you analyze the type of foreign body?
Yes.
Your presentation, because you're telling it's a retrospective study.
Correct.
You have you analyzed the type of foreign body?
Yes.
Whether it is metallic, non-metallic,
correct.
or vegetative or something like
yes.
that?
63% had metallic foreign bodies. It was in the presentation as well. Wood was seen only in 6 cases. That is around 5% of the presentation. But it was metallic was the most common here, followed by glass and then wood. I could not hear you, sir. Sorry.
Is there any relation between the sympathetic ophthalmic etiology basing on the type of foreign body?
Not really. The thing is, sympathetic ophthalmia can present in any individual post-surgery or post-injury as well. We cannot predict in which patient it will happen. Sometimes even with post-TSCPC also, an individual can lead to go into sympathetic ophthalmia. So type of foreign body in the literature as such is not mentioned which foreign body will lead to higher incidence of sympathetic ophthalmia.
Sir, we'll go for another.
Okay, thank you.
Thank you so much.